One of the things that causes shoulder problems is repetitive lifting or overhead activity. So reaching, throwing, swimming, or anything like that where you're doing repetitive overhead activity, weightlifting, can cause bursitis and tendonitis. And of course, previous injuries like a dislocation of the shoulder will tend to result in arthritis in the shoulder when you get older. When the pain doesn't seem to go away and it's interfering with your activity and you think you want to find out what the diagnosis is and consider the different treatment options, then you'll know when it's time to see an orthopedic surgeon.
Shoulder replacement recovery is a little different than hip and knee replacement. Shoulder replacements require a bit of patient's cooperation. There is a little bit of a healing process and a little bit of a process of early immobilization or minimal use to allow the soft tissue to heal before being aggressive. So that's a little bit of a different, probably most likely for the first 3 to 4 weeks, slaying with some mild range of motion exercises. Then we can be more aggressive with pulleys. And then after about 6 to 8 weeks, we can be more aggressive with active assisted exercise to get patients strong. The recovery is a little bit more different than hip and knees, which are basically, we encourage people to be very active, very aggressive without limitations. What you've seen right now is a boom in shoulder replacements. If you previously had bad rotator cuff disease, you couldn't get a shoulder replacement before reverse shoulders. So I think shoulder replacements can be durable. There's ways to do them to try and optimize implant positioning. One of the things I use is a blueprint from Tournier, which is a CT scan of the shoulder. You can get a 3-dimensional guide of the socket so you can put the implants in appropriate position. Very nice to have optimal positioning of implants, which will increase durability. I think shoulders are close to joint replacements, hip and knees, probably 10 to 15 years for 80% or more survivorship. I think is a pretty good number.